All right, everybody. It looks like we're right at 1 o'clock, so we will go ahead and get started. First of all, Happy New Year. I hope everybody brought in 2026 in a fun and healthy way. I know a lot of people have been sick. Really excited about today's webinar as we will have Deepthi Bhatina, our CEO and founder of GW RhythmX, as well as Dr. Fraunfelter presenting the RhythmX AI precision care platform. So I know we've talked a lot about that in the last month, so this will be your opportunity to actually see it live and in motion. So just a reminder for those of you who may be new, we do have Get Well Wednesday webinars the first Wednesday of every single month, starting at 1 o'clock p.m. Eastern Standard Time. These are also recorded, so if you're not able to attend live, we will send those recordings out. And we also do rotate topics every month to keep everything fun and fresh so that you learn something new. The registration for this series is really easy, and once you do it once, it will go ahead and put it on your calendar going forward. To follow up this webinar where we're actually going to see RhythmX AI kind of in motion, in February, we are going to hear from one of our clients. So we will have Lori Walker, CMIO of Presbyterian Healthcare Services, join us with Deepthi to do a fireside chat so that you can hear firsthand how this is working for their organization. Just a few housekeeping items. Everyone is muted because it's a webinar just due to the size. You can use the chat feature throughout for comments or questions. I will try to call those out if possible. We always say we save time for Q&A at the end, but I do feel like this one's probably going to go the distance. So if we do not get to Q&A in the end, there will be a survey that pops up where you can put any questions or requests there, and we will get back to you. So with that, I'm excited to introduce again Deepthi Bhatina, our founder and CEO of GW RhythmX. You met her last month for our December Get Well Wednesday, as well as John Fraunfelter, who is our Chief of Clinical Strategy for RhythmX AI. And with that, Deepthi, I will go ahead and pass it to you.
Hello, everyone. Happy New Year. Quite an honor to be here today with all of you, and very excited to be sharing with you some of our spotlight innovation. Um, Over the last couple of years, we've developed a precision care AI platform which helps deliver right care at the right time by the right clinician to our patients. And we've done it through delivering medical super intelligence, and we have about 50 plus practicing physicians and specialists who work literally on day-to-day basis with our AI leaders to be able to develop this level of medical super intelligence that has literally wowed the industry. So I want to take a couple of minutes to give you an overview of what that innovation is. And then Dr. Fraunfelter will do a live demo for you today. And as Misty said, in early Feb, we'll actually bringing in CMIO of one of our major clients, Presbyterian Health Services, who actually adopted this for primary care across the enterprise. And all the clinicians are calling this innovation a game changer. So we're very excited to be able to give you a glimpse into what that is today, given the time constraints. So the quick overview here is that, as you all know, in the industry, there is data, but there's too much data and it's fragmented. And gone are the days where a patient could be coming to see you, whether it is an inpatient setting, or they could be home, or they could be seeing you at emergency, or a specialist, or primary care. Doesn't matter where they are. In the modern medicine, the whole person care needs to be delivered to be able to think at the junction of not only what clinical conditions does this patient have, what comorbidities, what are all the conditions, what medications is a patient using. We also need to combine it to think about what about the social aspects. Does this person have any affordability issue, transportation issues, any mental health conditions to accelerate the diseases? How about the financial aspects? What health coverage or what insurance does this person have? Because depending on that, the cost of healthcare also varies. And again, in the modern medicine, it is about bringing all these things together. The data exists, but it's all over. And you'll see today in our precision care AI platform What we deliver here is converting that intelligence into impact. Anybody could have an insight here and there, anybody could have intelligence here and there, but what does it truly take to convert this intelligence into impact at every point of care with patient at the center? So today we will select primary care as a sample to show you, but we are rapidly expanding into every other care setting as we speak into specialists, in patients, into urgent care, different areas. And after you take the demo from Dr. Fraunfelter today, we would love to hear of your interest in any of this. And as I mentioned earlier, what you're about to see in the demo is this, is how do we move from intelligence to impact? That is the most critical. And what we've seen is that takes four main buckets. One is the precision care AI platform, the GW RhythmX, takes about 10 different data sources into the platform. Your EHR, structured, unstructured data, any social data you may have in various aspects, quality measures, the clinical guidelines are getting factored in, and we track the changing guidelines, your payer data, formulary data per patient, any custom data you may have. You may have your own data sources that you want us to integrate. The whole platform got built for custom integrations. On top of it, we overlay extremely advanced agentic AI that the industry calls as medical superintelligence. And this is not just AI, this is a combination of very deeply clinically vetted AI. We've completed 30,000 clinical validations so far of the AI you're about to see. And as you all know, you could have world's best thing a mile away from your home. Clinicians are not going to drive a mile away each time they want to look things up. The major way you drive adoption is take all of this hyper personalized super intelligence and deeply integrate into your EHR. We read and write back into your EHR, so it is very seamlessly and deeply integrated into your current workflows. And the outcomes, that's where the outcomes come from, are strongly aligned between the patient, clinician, and the health systems as well. Because you'll see the coverage across clinical, mental, social, financial aspects all coming together at the point of care within seconds when the patient is right in front of you. And we are very excited about sharing this innovation with you. Dr. Fraunfelter, if you don't mind, let's dive right into the demo.
Thank you, Deepthi. I'm going to share my screen here, and I'd like you to confirm in just a moment that you can see it.
Yes, we can
All
see it.
right, very good. And as Deepthi was saying, all that we strive to do is to know the patients completely so that we can do the right thing for the patient the first time. And as a clinician, that's a struggle today. It is so challenging. And in spite of the electronic health records being as powerful as they are, the completeness of the data that we use is a necessary requirement. Then the agentic AI capabilities, which I'm going to demonstrate here, enable me to be faster, and you could say even smarter as a clinician, better, smarter, faster, and so that the right things are done for the patient every time. So this is Sonia Carter, and I'm going to, as Deepthi said, I'm going to take this in the context of a primary care visit, but we're moving into specialties rapidly into inpatient care, and so this is a taste test for folks today. And I'm going to show you three panels here: the patient summary, and I'm going to show you in the top priority recommendations how I can take actions very quickly on the patient. And then this is my AI expert window here at the bottom where I can interact and have all of the support that I need as a clinician, whether it's clinical or financial, patient education, patient support, whatever those things might be. That's where I get support down here in the bottom. So we'll start back at the first panel here in the patient summary. And I need to understand Sonia Carter, what's been happening with her. And to do that, I'm always going to glance back a little bit, review and put a summary together in my mind before I go in and see her, especially somebody that's this complicated. But the problem is if I do a typical summary of the chart, I'm going to miss things that are 5 years, 10 years ago, that she had a history of cancer in the past, or tests that were just done recently. Finding those things is very difficult. We go back more than 10 years and search through the documentation to summarize what's happening with Sonia right here in front of me today. So as a result of that, I have here a snapshot of her social history, recent appointments, but her conditions are prioritized. Now, this is where the clinical intelligence comes in. As Deepthi mentioned, the agentic AI with the clinical agents inform for me what is most urgent to focus on today. Of all her conditions that are listed here, these at the top help me think through what am I going to do next for her today while she's right in front of me. And then we also identify patients that have conditions that are not even yet diagnosed. And that is in patients with chronic disease. That's a very common scenario. So I'm going to click on this potential new conditions here. We've identified that she likely has chronic kidney disease. And we give the rationale why. We give potential, and again, this is the ambulatory setting. This is ICD-10 codes that I could choose here. Here's the data behind it and the guidelines as a refresher for me. All of this allows me to primarily verify the information and say, yes, in fact, she does. And I can click on this ICD-10 code and it will route directly to the diagnosis list. Now, I also want to know what else has been going on with Sonia Carter. And coordination of care, this orchestration concept, is an evolving concept in medicine. We know handoffs and fragmentation in healthcare today are where things break down. So I'm going to click on this orchestration prompt, which says, what else has been going on with her? What do I need to know about before I go in and see her? Are there any tests that are pending that weren't done for whatever reason? And in fact, I can see she's seen a few specialists and there's some completed procedures here, and then a couple that still are ordered but not yet done. So this is what I'm going to focus on with her to say, hey, let's get that PFT done. And we're going to repeat the TSH as well as any other blood work today. So now I'm ready to go in and see her. And these top priority recommendations are, again, supported by our clinical advisory panel. These are linked to clinical guidelines. This is tying together the whole patient context. So what physicians and providers, APPs, what they're doing today is, I've got this patient with congestive heart failure. I need a refresher what I'm going to do. I'm gonna go out to a publicly available large language model like GPT or ask some other reference source, but it's external to the patient, doesn't have patient context. And when I lose that, then I lose the reasons why there might be exceptions or why I want to think about option B instead of option A. So this ties it all together and does the work for me. This is my support as I'm thinking about her. And the recommendation for heart failure is discontinue diltiazem, start a beta blocker. So I'm going to go ahead and accept that. And one other point here from a financial standpoint, there's a large amount of cost related to medicines that are prescribed where there's a cheaper alternative. So I can click on this shield here, and this would be applicable whether I'm in fee for service or fee for value, or if I'm inpatient, what's on formulary, to know what's available, but also to know what the best, right, and cheapest drug is really important. So this allows me to see my options here. And then I could go ahead and order the beta blocker. I'm going to do one more thing. This is specific to ambulatory, but we're also getting a recommendation to start a GLP-1 receptor agonist. Those are very popular. We've seen in the last few years. So, and I need a prior auth for that. So I'm going to write a prior auth for semaglutide. This is most commonly done in the ambulatory setting. But regardless, sometimes a prior auth for things is required on inpatient. We'll pull together all of the relevant information and the rationale, the logic, the justification, if you will, what else has been tried. And so this is all at my fingertips now to say, yep, this is correct. And I'm submitting this for approval. So we can go ahead and expedite care for the patient. It will also ensure that when they go in and try and get that prescription filled, that they actually come out with the medicine instead of getting notified or a call from the pharmacy that it wasn't working. Now, I want to look at regardless of setting, and I'm sensitive many of the folks on the call are inpatient. It doesn't matter. Inpatient ambulatory, we have quality measures and standards we adhere to. And so I'm going to click on the quality measures here. And this tells me, based on where she's at right now in the ambulatory setting, that these are required quality standards that need to be addressed for her in order to be complete. And we know how important those are. The next thing I'm going to show you here is, again, we did just identify and diagnose her with chronic kidney disease. She's got no knowledge or communication about that. So I'm going to click on this patient communication prompt, and it's going to give her education about her chronic kidney disease. This is valuable for her, let's say newly diagnosed, again, in the clinic or in the hospital, doesn't matter. But it's also sensitive to her, I gave it direction here, make it sensitive to her Hispanic background. So as it's giving a diet plan, this diet plan is Hispanic friendly, chronic kidney disease specific. And so it's giving recommendations that would be familiar to her, more likely for her to both understand and to follow. Now, many times we're going to refer to a specialist. And what I need to do as a provider is do several things. One, make sure I'm thinking through, is this the right reason to send to a specialist? Have I done all that I can first? And then secondly, communicate to the specialist about the rationale for that. So I'm going to start with, what would a nephrologist do? What can I do for her that a nephrologist would do? But I can start right here today. This is my specialist right here with me. Some health systems pay money for an e-consult, which is a provider talking to a specialist. This is talking to a specialist to get the guidance and recommendations right here about what can be done. And then I can write a referral to a nephrologist. So that we'll communicate to them, here's what I'm thinking, here's the reason for the referral, and so the communication is very clear. Now, let's say she's having some other complaints as well. So I'm going to click on this differential diagnosis, and she says, hey, I'm also having some symptoms of bloody diarrhea and abdominal pain. We're not going to make it simple on her today. So she's got bloody diarrhea and abdominal pain. What should I be thinking about in her context with her conditions? What tests have already been done and what tests could I do? What tests should I do and consider? So here's a good, reasonable differential diagnosis. And this gives me information from the chart, so I don't have to search through. Well, what was that latest lab test? Was there colonoscopy done? What other studies that are relevant to this problem do I need to go and find and search? No, it's all right here at my fingertips. And then I can immediately refer for a colonoscopy. I can take the next steps, and I can review these tests, click on these, and these will route to the orders as well and be in a shopping cart essentially where I can sign off on those. Those we've done the integration into Epic, and so that the work for clinicians is the thinking, but not the figuring out how to take next steps. We've taken some of the logistic work out, and also we're supporting, again, the hardest part, which is thinking about this patient, pulling everything together, thinking through a differential. So we help the provider end to end in this encounter with the patient to make it the very best possible experience for both the patient and the clinician. I'm going to now click on this generate assessment and plan. This will give me a summary of what's going on with the patient. We often have in play also digital scribes, and those will create assessment and plans. Those will create my documentation, but I might need to take this and add it in to that note because this is more detailed and more complete. And I can just click here, say give me more detail, and it will blow that out. It will expand it so that I can pull any part of this and add it into my documentation that I'm creating. So this is a complete, thorough, and billable note. And again, the clinicians have to think about the patient's context and their story. They have to think about the clinical guidelines. How do I make this most billable? All of these things are converging as I take care of each of my patients all day long. So we can cover a lot more, but I want to pause there, ask Deepthi, first of all, is there anything you want to highlight here? And we probably could take a couple of questions from the audience as well.
I think we can take questions from the audience. Any questions, thoughts? Is this available on Oracle? Yes, we built a EHR agnostic platform where irrespective of what EHR you have, this integrates seamlessly into everything.
Yeah, and there was another question come in. Is this in the Epic showroom already?
It technically should be. We'll check with our team and get back. This is Epic approved because it's reads and write backs to Epic as well. And Epic keeps changing their names for these showrooms to different names. So we'll check with the latest name and get back to you, but fully Epic approved. Other questions? One thing we would love to invite you to is this is a live platform. Our engineers are working on it as we speak. Do you want to ask a question about the patient themselves? And John can type them in so you can see the answers real time. Like John, for example, we could start typing something. My patient just said she got depressed. And are there any medications do you think I should change or would have impact on her depression? Something like,
Sure.
I'm just giving sample questions to trigger your thoughts. It could be anything, literally. Do you want to put your questions for the platform or for us in the chat and we'll type so you can see the real-time answers? This is not canned.
Yeah, it looks like we had one come in. Lucia, I'm going to click allow to talk, so you should be able to come off of mute.
Right. And the next question is language other than English enabled. Yes, you could do literally hundreds of languages. People had to finally use some rare language only 10 people spoke to break it, but we should be able to do. So first thing, if you look at depression, John, let's show the question we asked. She reports depression, give me consideration and how to approach. The platform would show history. She got diagnosed in 2019. Other things that could be factoring in symptoms, medications, what approaches would work for her, and what clinical guidelines got approached. Uh, now, maybe, John, let's write a letter to patient's 19-year-old son and say, write a letter to Sonia's 19-year-old son. Be very clear about when to give what medications to his mom and why. Make it funny.
All right. So funny letter to the 19-year-old son.
So you can see keeping it very light and funny. Your mom's official medication sidekick, morning with food, the no list. Clear instructions are written to the 19-year-old son, keeping all her medications in mind, and at the junction, the med adherence. Now I want to address the next question. Christy asked, language other than English. John, let's translate this into Spanish, French. Let's try like a couple of languages so people can see.
I'll do Spanish first and then French.
Sure, I can't read either, so I wouldn't even know which one you went first with. Those of you who can read Spanish, you can see that and later translate this to French. Christy, if you're hearing, hope your question is answered. Next one, Vandana. Every patient responds to the same medication. How the AI should provide recommended contribute. What are the other models we'll look at before? So before giving medications, Vandana, what the AI looks at is the clinical aspects going back by decades. And within that, we look at both structured notes and unstructured notes as well. And then we combine it with clinical guidelines. As if you can scroll up, John, you can see even under the depression notes, the latest relevant evidence-based guidelines are picked up. And say this patient has CKD, we would pick up the relevant evidence-based guideline, and multiply it by with thousands of data points for this patient. And then we look at what is part of her formulary, what is covered for her cost. And then we also look at the clinical notes to say, was this already tried and failed? Does she have allergies? All of that is being factored in before you give recommendations. Maybe, John, to answer Vandana's question, put in a medication of your choice and say, hey, has this ever been tried? If not, should I kind of question? Yes, Andrea, this is available on Oracle Cerner as well. We built it for a platform, EHR agnostic way. We can integrate it into any EHR.
So I just chose a beta blocker because there was a recommendation already related to the heart failure. So no previously prescribed beta blocker. Here are the indications, monitor, here's how to start it, and consider her renal function and diabetes when I'm administering it.
Vandana, these are the types of things we show about any indications, contraindications, what else should be discontinued. The full picture is here. Do you use clinical practice guidelines from VA and do you add changes? We, for now, use clinical guidelines that come from several industry experts we have for each condition, and we work with the health systems. For VA, we are happy to take any VA-specific guidelines and factor this in because the whole way the platform got built, Lucia, is to be able to factor in your guidelines, and you can set the precedence as well. Like for VA, we could load VA guidelines for CAD or diabetes, giving an example. And where you see references, if you prefer, your CMO prefers, you could always say, make VA guideline take precedence over the ADA guidelines, and we can easily do it. That's how the platform got built. And the other thing we could also do is on the right-hand side, where you see discontinue dietism, do XYZ, the recommendations here could also be anything. Like say you have a digital diabetes program that you built in your health system and you really like it. And this patient's diabetes is progressing. You should be able to show there to say, hey, start this person on this XYZ program. And when you click on the why rationale, John, if you can click on the why rationale, because I think some people missed the early demo, we would show full transparency of this is exactly why the patient would qualify. These are the clinical labs. This is what the guideline. And if you put on the formulary there, we can show the prior auth. Is it required? Or is it a step therapy, or does this person just qualify directly? It's all in there as well. Yes, we'll look at the more updated research outcomes. And the thing is, we developed a proprietary clinical validation methodologies that are extremely sophisticated, Vandana, where our clinical and AI teams do double-blind validation studies. A portfolio of LLMs are double-checking. Literally, the AI you're looking at went through 30,000 clinical validations, and hence the instant high trust where we went live.
And Deepthi, just doing a time check, looks like we've got a little under 2 minutes.
1 second, I want to address a very important question.
Yep.
How is RhythmX AI associated with GetWell? We merged. We are one company now. We are GW RhythmX, and it's all one company now. And if you are a GetWell client, you're right now RhythmX client as well. But every time you hear GW RhythmX, please know that's the name of the new merged company. RhythmX AI is headquartered in the Silicon Valley and known for medical super intelligence. And GetWell is known for decades of trust and very strong foundation of 150 marquee health systems. The reason why we merged these both companies is it's the best of both worlds, bringing in cutting edge, clinically validated AI into a very trusted base of 25 years. So this is a perfect combination. And for those of you who joined late and who's wondering, who are you? I'm the CEO of the new company and founder of RhythmX AI. What is the process for exploration of this in our EHR? We are happy to. You have Misty's email ID, and I'm also putting my email ID here. Misty, instead of all the indirect loops and hoops, I want to make sure anyone who is interested in learning more about this and trying it in their health system, I want direct access. Please publish your email ID. Mine is in the chat. And also John's. Reach out to any of us. I welcome you to reach out to me as well, and I'll make sure we get in touch with you to have you explore. And if you want to do a pilot, happy to get that done as well.
Absolutely. There will also be a survey pop up after this if you want to put your information in there as well. We can get back in touch with you. You can let us know if you have questions or do want a demo or to talk a little bit more about how to integrate this into your EHR.
And I would definitely encourage you to attend the Feb 4th session because the CMIO or Presbyterian, they're literally wowed by this medical super intelligence. They just expanded enterprise-wide to clinicians as well. You'd be amazed. Lori Walker is very mission-driven, and you'll be very amazed to hear directly from the client's perspective of how this is making huge impact in their everyday world to the clinicians. Thank you.
Absolutely. All right. Looks like we're 1 minute past. As a reminder, this recording will be sent out to everyone if you want to go back and reference it, come up with any questions, request a demo, anything like that. So, big thank you to Deepthi and Dr. Fraunfelter. And I hope that we see you all in February.
Thank
Take
you.
care.
Thank you.